There have been several new locations added to Queensland Health's list of COVID exposure sites as authorities prepare for more positive cases today. It comes after several people were arrested and fined for not complying with Brisbane's lockdown. Police issued 70 infringement notices and arrested 21 people yesterday, some of which were related to an anti-lockdown protest. Just before we go to our reporter, let's take a look at what's happened with the cases in Brisbane over the last 5 days or so. We do have that graph. So that first case, the student at Indooroopilly in Brisbane's inner west, popped up on the Thursday night. Then 6 cases on the Friday, 9 on the Saturday, 13 on Sunday, and the concern is that's going to grow today. We're expecting that media conference with Queensland authorities in about an hour's time. We'll bring you that live here on the ABC News channel. In the meantime, here's reporter Michael Rennie in Brisbane.
I'm standing outside a drive-through testing clinic at Toowong in the suburb of Toowong. It's just opened and the cars are starting to pour through here this morning. There is a line of cars here, Michael, stretching all the way around into a car park and well back that way towards the back, that way along the road. There's just cars been here since about 6 a.m. this morning, and a lot of people in Brisbane that looks like you're eager to get out and get tested as quickly as possible. We saw 21,000 tests recorded yesterday. I'm sure we're going to see a lot more today if this is anything to go by, and by some of the lines that we saw yesterday as well. But in an extraordinary move, the Queensland Government is looking to do some surveillance testing on the Sunshine Coast today at several schools. So that involves testing students that may not be showing any symptoms at all. So they're trying to look for any missing links to this Brisbane cluster, which now sits at 31 cases. We saw 13 cases announced yesterday. 10 of those cases were children under the age of 9, which is extraordinary. And so we're just waiting to see what else comes out of this over the next couple of days. But so the situation here this morning, lots of people coming through here, and yeah, it's just quite extraordinary, really. But look, I've seen out this morning, there's been a lot of people out and about already on the roads this morning. And the message from authorities is if you are not an essential worker, you shouldn't be out on the roads at all. You should be at home with your families. There are real fears from the authorities here in Queensland that this situation that is unfolding at the moment, if we don't get on top of it now, then we could end up in a situation like we are seeing unfolding in New South Wales.
Michael Rennie reporting there from Brisbane. And so that key COVID update from Queensland will happen at 10 o'clock Eastern time this morning. So that's in an hour's time. We'll bring you that live here on the ABC News channel. And we're expecting the New South Wales update as usual at 11 Eastern time. More coronavirus exposure sites have been identified outside the 8 local government areas facing tougher restrictions in Sydney's west and southwest. And the Australian Defence Force says there's been a positive response to its presence as military personnel help New South Wales Police deal with Sydney's outbreak. Before we go to our reporter, let's take a look at a few maps and graphs. So this first one shows the number of exposure sites in very roughly defined areas in Sydney. So these are spots where there's been a COVID positive person and there's the chance of transmission to others, places like supermarkets, restaurants, workplaces. This is just Sydney. And you can see that biggest number, 184, in that broad area covering the inner west suburbs like Campsie and kind of verging into the southwest as well. Suburbs like Campsie, Canterbury, north to Burwood and south to Kingsgrove. 124 is further west, so that covers Blacktown, south to Fairfield and further south through to Canley Vale. Then that 36 further south includes the Liverpool area. And interesting to note that 26 number north of the harbour there, including places like Belrose and North Curl. And there are a couple of spots in Lane Cove that were added overnight as well. The next map shows where positive cases live in the health districts of Sydney. These are the larger areas that can include dozens of council, and this southwestern district has been accounting for by far the majority of cases over the last several weeks. So that starts just south of Parramatta, goes through Liverpool and Campbelltown out to the Southern Highlands. 1,672 people with COVID there now, and that's out of a total of more than 3,600 cases in this outbreak so far, with 15 deaths. The Western District has 679 cases, and Sydney and the inner west area has 473. And if we zoom in to show a few of the council areas that have big numbers of cases, Fairfield still far and away has the most cases with 953. Neighbouring Canterbury Bankstown had the biggest jump in cases yesterday to 658. Liverpool now has 296, and some of those other councils with tighter lockdown rules include Cumberland at 356, Blacktown at 206, Parramatta 93, Georges River 102 and Campbelltown 108. And this last graph shows what's happened with the case numbers over the past few weeks in New South Wales. The last 7 days have been seeing the biggest numbers so far through this outbreak, sticking around, I guess, an average of around the 200 mark over the last several days. And the yellow portion of these bars are the numbers of those cases in the community while infectious. While it looks like that number has been decreasing and stabilising, there's a big question mark over that, because the number of cases that authorities just haven't worked out at the end of each day has been quite significant, some days more than 100. And so, yeah, there's a big question mark over what's happening with those numbers of people, number of fresh cases who've been in the community while infectious. Reporter Nakari Thorpe joins us now from Sydney. Nakari, g'day. So take us through what these concerns over what's been happening at Westmead Hospital.
Yeah, good morning, Joe. Well, a staff member at Westmead Hospital has tested positive to COVID-19. We understand this staff member worked about 3 shifts last week while infectious, and as a result, 36 other staff members have been considered close contacts and now are in self-isolation. Now, health authorities have confirmed that this particular staff member was fully vaccinated. They've also said it appeared the staff member contracted the virus whilst in the community, but at this stage there is no evidence that this has been transferred to any patients at the hospital or a further transmission at this stage, and that affected area of the hospital has now been deep cleaned. Now, this comes as the aged care facility cluster at Summer Hill, the Wyoming aged care facility, that cluster has now grown to 20. 18 residents there and 2 staff members have now tested positive to COVID-19. Those positive patients have been moved to hospital, transferred to hospital as a result of that. And also the remaining patients on the top floor of that facility have also been moved to hospital as a matter of precaution. Now, the New South Wales Health Minister, Brad Hazzard, said the rising number of infections at this particular aged care facility was because of a Christmas in July event, which he's described as a super spreading event. But however, a spokesperson from the aged care facility has clarified that this was in fact a monthly lunch that is put on by the nursing home for residents there, which did have a Christmas theme. Now, we also understand that a nurse at the same Wyoming aged care facility worked across a number of different aged care facilities in Greater Sydney. So now the health authorities and the Commonwealth are working together to come up with a plan or to put a stop to aged care workers working across multiple sites. They say this situation highlights the importance and the need for aged care workers to be vaccinated. Now, of the 61 residents, 50 were vaccinated. The remaining 10 declined to be vaccinated for a myriad of reasons, including medical reasons, and about 3/4 of the staff members were also vaccinated. Now, yesterday we heard from the Premier, Gladys Berejiklian, again ramping up her calls for New South Wales to be vaccinated. She wants to see the month of August people across the state be vaccinated. And we also heard her talk about defending her government's strategy to take Pfizer vaccines and redirect them from regional New South Wales to Year 12 students so they can return to face-to-face learning. Now, she was asked a question that she took offence to at yesterday's press conference, saying that which suggested vaccines were being taken from Labor strongholds in the Central Coast area, which we've heard people there have had their Pfizer vaccinations cancelled, and there's been concern and anxiety about that. So the Premier has defended that as saying that this is a necessary move and that's something that's in the best interest of public health. Joe.
And Nakari, explain for us where you are this morning. Is that a testing site or a vaccination site, and what's the attitude among people there?
Yeah, so Joe, we're here at the Sydney Olympic Park Vaccination Centre. We've seen a slow, steady stream of people coming through this morning. Look, I think the overall feeling is that people just want to get vaccinated and get on with it. A lot of people just want to get out of this lockdown, and this is one way of doing that. We heard that again from the Premier that she wants to see 80% of the adult population across New South Wales vaccinated. So there's no doubt people coming and going today here at this vaccination hub.
Yep. Okay, Nakari Thorpe reporting there from Sydney Olympic Park in Sydney's west. And just repeating, so there's a lot of anticipation about these media conferences today with millions of people in lockdown, 5 million in the Sydney area and about 4 million, I think it is, up in southeast Queensland. So everyone really interested to hear what's happening with these media conferences each day. 10 o'clock is the time confirmed, 10 Eastern time confirmed for the Queensland media conference. We'll bring that to you live, and 11 o'clock Eastern time for the New South Wales media conference. We'll have it all covered for you here today on the ABC News channel. Victoria has recorded 4 new locally acquired cases of COVID in the 24 hours to midnight last night as the state prepares to introduce tougher border measures with New South Wales. Reporter Steph Ferrier joins us now from Melbourne. Steph, so yeah, 4 new cases. So they're still bubbling along, these cases, but every day it seems they've been in isolation, and so there's no real threat of any transmission from these fresh cases.
Yes, good morning, Joe. In fact, that's what we've got again today. So once again, all of these new cases were in isolation for the entirety of their infectious period. And we always knew that we'd have quite a few people within a same household of an infected case testing positive along the way, because we had so many thousands of people isolating as primary close contacts. But this is really great news. It's effectively what Daniel Andrews earlier said, the Premier said, was effectively a 0 day, because eventually we will see all of those close contacts go through, and then after that we will get back to hopefully 0 days once again. But it does come off the back of decent testing numbers, 22,000 test results received. We also have around 16,000 or 16,500 vaccines administered as well, so that's still tracking along pretty well at our state-run hubs. Also importantly, our exposure sites, they've really gone down significantly. So there's now just 56 exposure sites that are out there at the moment across Victoria, from our peak of over 300 or so during the height of the recent outbreak. And the last one was added on Saturday, so that hasn't moved at all. There's no further risk out there of the community at this stage.
And Steph, you're several hundred k's south of the New South Wales-Victoria border, but there's a bit of frustration there this morning with the changes to the rules.
Yes, there is a lot of frustration and anxiety, particularly from business owners who have already been really hit hard by a lot of these repeated lockdowns, and now they're copping it once again. Unfortunately, the border bubble arrangements, there will no longer be free flow of travel from 11:59 tonight. That means that residents that live in those border communities who used to enjoy unrestricted movement back and forth now will only be allowed to go across the border for 6 essential reasons. Now, this just doesn't include the people who enter into the state from New South Wales. This also includes Victorians that are heading north as well. They'll have to abide by the same rules. Many are saying that this is really going to cause significant financial impact, because there are things like hairdressers and other people like that, for example, that aren't considered essential, that will be missing out on businesses. And at least the Albury Mayor has also said that really it would have helped if they had have come up with an extra financial assistance package for those people at the same time as announcing these rules. But we'll wait to hear what further information there is from the state government when they come up, and no doubt that will be one of those questions raised at the press conference.
And Steph, what's happening with the Victorian State Parliament today?
So State Parliament is going back and resuming after its 6-week break. This is the first time that we'll see Premier Daniel Andrews returning to face question time since he broke his vertebra and also 6 ribs back in March after slipping on those wet stairs at the Sorrento rented holiday house. And so there'll no doubt be a lot of grilling to do with the COVID situation, just how quickly we can come out of some pretty tight restrictions here while we're in while we've come out of lockdown, there are still quite a lot of restrictions that Victorians are facing. We are going to have the tabling of a parliamentary inquiry into the events industry and just how much that's being affected. And to that end, we had the Liberals and the opposition, the national parties as well. Politicians turned up to get a rapid result testing facility that was right at the front doors of Parliament that they set up. And they were trying to say that this is really important for some of those big events where we can attract big crowds again. The opposition leader, Michael O'Brien, said that if we had have had this just before a couple of these super spreader events at the MCG and Amy Park, then perhaps 15,000 people might not have been locked down. And he's wondering why, he says, the state government is so reluctant to introduce this technology. Let's have a listen to what he had to say.
Rapid testing is a way that we can have greater confidence that we can stop the spread of COVID-19 in this state. Rapid testing is already used in our court system. It should be rolled out right across Victoria to keep us safe and keep us open.
We've already heard from the Sports Minister for One, Martin Pakula, yesterday saying that this rapid result testing is unlikely to be used at the AFL at least because the technology still needs to be refined. There are still possibly false positives that come through. He's also ruled out the possibility of a no jab, no entry proposal for this season at least. And he also says that the AFL Grand Final definitely will be played here in Melbourne after missing out last year.
About 2,500 Qantas and Jetstar employees will be stood down for an estimated 2 months in response to the ongoing COVID outbreaks. Qantas says the stand down is a temporary measure to deal with a significant drop in flying caused by restrictions in Greater Sydney and border closures in other states and territories. It says no job losses are expected. The decision will directly impact domestic pilots, cabin crew and airport workers, mostly in New South Wales, but also elsewhere given the nature of airline networks. Should Australians be paid for getting the COVID vaccination? Federal Labor wants $300 offered to anyone who's fully immunised by December the 1st. The government has already ruled it out, saying the idea is insulting and wasteful. Political reporter Stephanie Boris joins us now from Parliament House in Canberra. Steffi, g'day. So run us through what Labor's proposal is to increase the number of people getting the vaccines.
Hi there, Joe. Well, there's two elements when it comes to the vaccine rollout in terms of the number of people that decide to get the vaccine. One, of course, is supply. You need those doses in order to get vaccinated. But the second element is a willingness of people to book that appointment. And Federal Labor today has announced its plan that it wants the government to take on, saying that $300 should be offered to anyone that's fully immunised between the beginning of the rollout back in February and December 1. The cost of this, Joe, it could be up to $6 billion, but Federal Labor leader Anthony Albanese says it's money well spent because not only could it increase the number of people getting vaccinated, but it also could help the economy.
We need to roll out the vaccine and get those rates up and use everything at our disposal to encourage those vaccination rates to rise. This is just one measure, but it's a measure as well that will support jobs and economic activity. There is no downside here, and the government should take this on board and should adopt it.
And Steffi, what's the government's argument for already rejecting this?
Yeah, well, they say that it's insulting, and the fact is that most people will consider the biggest incentive around getting a vaccine is that not only could it save your life, but it could save the lives of your loved ones. That said, though, they haven't ruled out targeted measures. We do know that the federal government asked its specialised economic behavioural analysts to take a look at incentives that have been introduced overseas and to consider which ones have and haven't worked. And this research has shown that large financial incentives didn't actually often see a remarkable increase in vaccine take-up. However, the research did note that where they did see changes in vaccine take-up was more around consequences of not getting the vaccine. So we've already had those discussions around whether people that are vaccinated should be the only ones that go to, say, large sporting events, or people that are fully vaccinated are the ones that can travel around Australia and then eventually overseas. So it's almost, Joe, the government's looking at consequences for those people that don't get vaccinated in that hope that more people will go and get the jab. So nothing's been announced as yet. For now, the Finance Minister, Simon Birmingham, says that Labor's idea is not one that will be adopted.
We've looked carefully at the types of incentives, and the evidence from behavioural economists and others government has worked with show that these types of proposed cash incentives from the Labor Party aren't necessary, won't change the dial or work, and ultimately would prove to be quite wasteful in terms of the overall scale of public expenditure. Now, what we're seeing from Labor is another typical Labor Party cash splash of some $6 billion without the evidence to back up that it's necessary or that it would work. Our approach is seeing Australians turn out in record numbers each and every day. And frankly, it's a little bit insulting to the many millions of Australians who know the best way and reason to get a vaccine is because it protects their lives and those of their loved ones.
And Steffi, where's Australia at with the effort to get everyone vaccinated?
Well, at the moment, nearly 41% of the eligible population, so that's people aged over 16, have had their first dose of the COVID-19 vaccine. Overall, though, 19% of Australians are fully vaccinated. So we still have a long way to go in terms of getting to that initial threshold of 70%, with the final goal of 80%. The government is hopeful, though, that 70% threshold can be reached by the end of the year.
OK, Steffi Boris reporting there from Canberra.